Artificial intelligence plays an increasingly prominent role in our everyday lives. Healthcare is one of the high-stakes domains that is rapidly adopting automated approaches with the development of healthcare AI. Prior work found that people trusted human doctors more than healthcare AI and were resistant to adopt healthcare AI. But who feels this way and why? Will people with different levels of trust or mistrust in doctors feel differently? If so, how can we earn the trust of those who have been hurt by these systems? Trust in medical and technological systems is often informed by their perceived potential to be fair or unfair. Many social groups currently and historically experience discrimination in medicine and in their use of technology. Would participants' previous experiences influence their perception of healthcare AI? Accounting for existing attitudes towards medical systems, such as trust or mistrust, is part of answering this question. Medical mistrust refers to a lack of trust in medical institutions, doctors, and healthcare workers. This can be caused by previous experiences with medical discrimination, a reality that communities of color know all too well. Communities of color have vastly different and situated reasons for attitudes towards particular systems. Much of the research on medical mistrust is currently specific to Black communities, so we sought out a balanced sample of Black and white participants. Centering the voices of our participants and understanding their concerns was of the utmost importance to us, so we conducted a two-part study, an online experiment, and a follow-up interview to better capture how they perceived healthcare AI. We had to answer this question with realistic depictions of healthcare AI. With the help of one of our dermatologist colleagues, we learned that photo imaging was one of the most popular techniques in healthcare AI, and that dermatologists were already adapting some of these technologies in their practice. So we situated our study with scenarios informed by Longoni et al. And healthcare AI currently used in dermatology. In addition to asking for demographic information, we deployed the widely used 12-item group-based medical mistrust scale to measure participants' level of mistrust in medical systems. We regard trust as something to be earned on the terms of those who have been hurt and seek to better understand those terms in their words. So we followed up our survey with interviews, asking participants for their suggestions and reactions to healthcare AI descriptions that attempted to address fairness and earn trust. Our online experiment and interview results suggest that participants who mistrust human medical providers perceive healthcare AI as equally untrustworthy and as unfair as human medical providers. Conversely, people with lower medical mistrust tended to trust human providers more and view them as significantly more fair, especially when compared to healthcare AI. The use of the mistrust scale allows us to account for varying experiences rather than only using race as a single demographic category. Not all Black participants reported experiencing high medical mistrust, but those who did had significantly higher mistrust than white participants. In our interviews, we found that attempts to explicitly describe a healthcare AI product as committed to anti-discrimination was more well received than one committed to fairness. While some were assured by commitments to anti-discrimination in theory, practical evidence and data of anti-racist aims were required for participants with higher levels of mistrust. Individuals with these concerns often asked directly about how representative the dataset and training materials were for people with darker skin tones. Many studies use human decision-making as a benchmark to measure people's perceptions of AI, and their findings indicate that people trust AI decisions significantly less than human decisions, particularly for decisions that are subjective or deemed to require human capabilities. Our work points out a critical gap in prior work. It does not reflect important differences in social groups. While most of the existing studies do not report demographic information about their participants, all studies were conducted on MTurk, whose users are predominantly white. Additionally, our findings suggest that previous work's approach of increasing the role of human decision makers in AI systems to increase trust may be ineffective for communities who face marginalization from human decision makers.